It was somewhat fortuitous. One of my senior partners, Paul Meyer, was the team physician for the Royals. When we were residents, we actually manned the first aid station at Royal Stadium, and so did that prior to joining Dixon Ively. I also sold beer at the stadium when I was a medical student, so I was involved in baseball for a long time, and then Dr. Meyer introduced Dr. Phillips and myself to the team, and we started, our first spring training was in 1979, so that was the introduction. Well, it was a very rewarding experience. I've now we participated in the 1980 World Series, the 1985 World Series, and I'm now physician emeritus, meaning I'm retired, but obviously got to watch and enjoy with the rest of the community this last series. I think it's just knowing what techniques are available, perhaps seeing a lot of different injuries, having a breadth of experience of treating not only recreational athletes but elite athletes, having contacts around the country where you can sometimes get some advice on treatment. I think being in the trenches in baseball particularly, we're at spring training for 4 to 6 weeks and able to see just a lot of injuries. We've been able to work with the trainers who have a lot of expertise in treating injuries. And I've learned a lot from training staff, coaching staff over the years. Watched lots of pitching sessions, catching sessions on techniques. I think all that goes into the total experience of being able to treat the patients. I think in particular MRI examinations, being able to see the soft tissue much more clearly. We used to have to rely on physical exam, injecting dye into joints. So it's made the diagnosis a lot more accurate. And there have been marked advances in arthroscopic surgery which enable us to treat injuries with less scar tissue and I think with better outcomes.